I have found acne to be a fairly challenging skin condition. And the reason is because it's primarily systemic. I think a lot of it again comes from the colon. I've absolutely seen clearing in acne lesions almost immediately when individuals have chosen to do some sort of a colon cleansing protocol. But aside from that, let's talk about what's happening at the skin and how we need to address it. First and foremost, let me identify what the typical agents that are used in most acne serums are and why I don't think they're the best choice for acne in general. Number one, let's talk about benzoyl peroxide. It's the gold standard, if you will. Although if you take careful notice, even some of the most outspoken dermatologists in the world that have been proponents of benzoyl peroxide for many years have changed their tune as more and more research has come out about how traumatizing it is to the skin. You see, every time you put benzoyl peroxide on your skin, you deplete all of its antioxidants. Because you're putting a pro-oxidant into the skin, it depletes your antioxidants. It's common sense. I think if some of the movie stars that are advertising their choice of skincare products and they're choosing benzoyl peroxide, if they knew they were aging their skin as rapidly as they are with benzoyl peroxide, they might have second thoughts about the lines that they're choosing. But that's benzoyl peroxide. Any oxygen therapy that you put into the epidermis will create oxidation that will require the utilization of your free radicals. And remember what I've been telling you all along. Your skin is starved on a day-to-day basis. It only has so many free radicals available. So every time you use something that depletes these free radicals, you're going to increase inflammation. Now, inflammation is at the core of every skin condition. But where it works in acne is this. If you have more inflammation and you have ongoing scarring happening, then that ongoing scarring will suffer. Number one, because inflammation on top of inflammation makes scarring worse. Number two, because if the skin has to deal with the inflammation of these ingredients you're using to treat acne, then it won't be dealing as effectively with the scarring that is happening on a day-to-day basis. Remember, every new acne lesion that you see is a scar in formation. To address these scars effectively, you have to use every possible skin nutrient that becomes available through the blood supply, and then as many nutrients as you can supply through the skin. Once again, most acne scarring occurs at the dermal level. That means you've got to penetrate ingredients to the dermis, and that's why I chose to use the phosphatidylcholine or the liposome delivery system that I do in all of my serums. Why do I love phosphatidylcholine for acne? Almost more than any other serum because of its unique ability to treat acne on its own. It actually has research behind it showing that 70% of acne is cleared by the use of phosphatidylcholine alone. And you may say that doesn't make sense. It's a water lipid soluble molecule, it's part of the cell wall. What's it doing to treat acne? It's very simple. And this is where the understanding of why acne continues to worsen in so many people who try the current products that are on the market today. You see, we all destroy the barrier every day, almost with every product line that's out there. Acne is as guilty of this, if not more guilty than everybody else, because there's usually more oil involved with the acne client. They're constantly wiping their face with some sort of alcohol or acid. These acids are stripping the lipids of the skin, and these are the good lipids, the lipids that aren't causing acne. They're the healthy lipids that create the barrier. So now we're dehydrated, and dehydrated skin has a response. It produces oil. Sebum is produced as a result of dehydrated skin. So every time you dehydrate an acne person, you actually are promoting the return of acne. And that's why everybody has rebound acne, quite simply. So here we have an approach where what we're doing is we're using the liposome to deliver ingredients to the dermis so that remodeling can be more effective. We have a liposome which is restoring the epidermal barrier so that they are not dry, they're not oily, their skin is well hydrated and very healthy. Number three, we're using ingredients that reduce the bacteria count so that we can maintain a very quick response. And in fact, most people that use Clarify, our osmosis serum, find that their acne is cleared within the first couple of weeks very effectively. The last aspect, of course, is the scar remodeling aspect, which I think makes the osmosis serum more unique than anything else out there in the market today. See, we're addressing the health of the skin, we're addressing the oil, we're addressing the bacteria, we're addressing the inflammation, and we're remodeling scar tissue. Yes, we're using retinaldehyde at very high strengths, which is proven in research to be effective against acne, and that retinaldehyde is increasing the dermal thickness, which is what we want to do. But the remodeling of scar tissue has to also come from the removal of debris, and that's where the 1,3-beta-glucan comes in. We're very excited about the end result of that. So you have to remember, acne scars are a very long-term process. We do not expect in the first 3 months of use for you to have dramatic changes in your scarring. However, we do expect the scarring to stop through the process of clearing of your acne. We do expect the health of your skin to be restored, which means you won't have rebound acne. And we do expect that over the years that you will continue to remodel that scar tissue, and the end result will be a dramatically improved skin, both in appearance and texture, and we're very excited that you're giving this an opportunity.